So let me introduce our speakers for today. Stacy Zhang is the Community Health Planner for Kane County Health Department. Stacy has worked in public health for 20 years and most recently led the Community Health Assessment and Improvement process for Kane County. In her work at the Health Department, she also supports the Public Health Emergency Response Team, assisting with surge capacity and emergency response for COVID-19. Ashley Went is a public health consultant with Conduent Healthy Communities Institute, and in this role, Ashley delivers technical assistance and capacity building to nonprofit hospitals and collaboratives in support of their community health improvement efforts. Ashley has over 15 years of public health experience, including domestic and international public health work. Ashley will be sharing her experience leading HCI's work around Kane's 2021 Community Health Assessment process. And as I mentioned, I'll be moderating our session today. My name's Jane Chai, and I'm the Community Health Content Expert from Conduent Healthy Communities Institute. Prior to joining HCI, I worked at the local health department in Orange County, California. As I mentioned, that's where I am today, and I was there for 15 years and led efforts around community health planning, quality improvement, strategic planning, and workforce development. So I'll kick off our conversation today with the theme that we'd like to explore with you. I think a lot of us have heard the term resilience quite a bit in the past year, maybe in our personal lives or in regard to our families. I think COVID-19 and the events of 2020 and now 2021 has really made clear the need for community resilience as well as part of a successful coordinated public health response. We know that there are different definitions of community resilience out there. For today, we'll consider community resilience the sustained ability of a community to withstand and recover from adversity. So for instance, stresses to the economy, natural disasters, or say a pandemic. And I think we've experienced all of these in recent times, often all at one time. Key levers of community resilience include promoting health and wellness through education and access to care, promoting community engagement and partnerships, working with communities towards self-sufficiency, and working towards quality and efficiency. Through Conduent's work with Kane County, we were impressed with findings from their local public health system assessment. The assessment was conducted in 2020 and revealed so many of those key qualities of community resilience I just mentioned. A system with strong partnerships where there's deep trust and a spirit of collaboration. Along with that, impressive community engagement. For instance, the Kane Health Counts Collaborative was mentioned by partners as providing leadership for collaboration around community health assessment and planning. An efficient system. As I mentioned, we conducted the assessment during the COVID-19 response. And even during that time, the emergency response system was lauded by Kane County system partners for efficient and effective communications across system partners. Finally, quality. Kane County Health Department was identified as a pillar for public health activities by the community. Partners pointed to the health department's attainment of accreditation and re-accreditation through the Public Health Accreditation Board as an example of the health department's commitment to quality. These findings are really tremendous at any time, but especially during such a critical time for public health departments across the country. And we really wanted to dive in and explore the elements that helped Kane County establish a public health system that showed such signs of resilience. One of the key underlying things we found was the strong collaborative community health planning process that the partners of Kane Health Counts had been involved in. So at this point, Stacy, I'd like to turn to you. So maybe you can give us a bit of background about Kane County and its history of community health planning.
Sure, thanks, Jane. And thank you so much for all those kind words. That's really means a lot to us. Yeah, I just want to start by giving a little bit of background on Kane County. It is located in the northern part of Illinois, about 40 miles west of Chicago. Much of the western portion of the county is designated as farmland. So you can see the population is pretty sparse. The more densely populated areas are in the eastern part of our county, and they surround our Fox River. Because of this unique mix of populations, our populations are quite diverse. You can see here in this slide, we do have some more populated areas, Aurora, Elgin, very densely populated. And then we have miles of corn and soybean fields. So we really do have very different health needs throughout our community. In cities like I mentioned, Aurora and Elgin, we have a large Spanish-speaking population. So we look at health barriers. We see them very greatly. For example, in those cities, finding services in Spanish can often be a barrier. When we look at cities in the more northwestern part of our county, transportation might be a common barrier for someone living in like Hampshire. So we also see the changes for public transportation, access to public transportation in the eastern part of our county is very accessible. We have the Metro train, we have PACE buses, where we don't have those types of services in the western part of our county. So one size does not fit all for Kane County. As you can see here, Jane mentioned that we do work with a collaborative. So this slide shows our collaborative partners that make up Kane Health Counts. There are 5 local hospitals that serve Kane County, and we also work with our Inc. board, which is a mental health funding alliance that serves the southern part of our county. So I just want to talk a little bit about the history of this partnership. A little more than 10 years ago, the health department was looking for a way to conduct a comprehensive community health assessment. So discussions started taking place with our hospitals and other agencies serving Kane County. Some were required to do a community health assessment like our hospitals. Some were just looking for more quantitative data on our community. So much like the health department where there's just 1, maybe 2 staff to really be available to work on a community health assessment project, you know, it is time consuming on staff. So, and oftentimes that staff person it's not their primary role, they're still required to do other tasks at the time. So it's time consuming. We were also looking for ways to relieve the financial burden, and splitting the cost between these organizations seemed much more feasible than carrying it ourselves. So ultimately, we wrote up MOUs and the collaboration was born. Our first collaborative CHA, or Community Health Assessment, was published in 2011. We, at that time, established a steering committee to make sure that there was representation from agencies throughout the county. As I mentioned, or I don't know if I have mentioned yet, but the health department is actually located in Aurora. I know I mentioned the county being quite diverse. We really wanted to make sure we were pulling in agencies that represented different parts of the county and really getting a good feel for other areas. So we were considering all of our communities. We had representation from the United Way, municipalities, libraries, our federally qualified healthcare centers, as well as the Inc. board. So in 2014, our collaborative actually took the MAPP approach. And if you're not familiar with MAPP, MAPP stands for Mobilizing for Action Through Planning and Partnerships. This is really just an in-depth way to incorporate a more comprehensive assessment. So we'll talk a little bit more about that, but I did want to mention that just so you know, we didn't jump into that right away. This might not be something your partners are as familiar with. So another barrier that we came across, and I'm sure this might be something that you're struggling with if you're looking to form a collaborative, is the timeline aspect. So the health department did adopt a 3-year cycle to stay consistent with our hospitals. Our hospitals are required to do a community health assessment every 3 years. So inevitably dates change. We've had hospitals in the past become acquired by a different parent company, and their timelines change. So adaptations are constantly being made. But one thing we found is that in every executive committee, which meets every other month, we do bring that timeline up and we review that timeline and make sure our partners are approving that so we can make sure we're staying on track and everyone's deadlines are being met.
Thank you so much, Stacy. I think that context is really helpful for us, in understanding the history. And I think a lot of us can identify with the barriers that you had around the timeline and, different parties being involved. Ashley, I know you led the Kane County Community Health Assessment process, not just completing the CHA for the health department, but also the community health needs assessments, the CHNAs for some of the local hospitals that Stacy just mentioned. What were your considerations? What were considerations you had for completing this collaborative process? And as Stacy mentioned about the MAPP process, I think this is something that health departments are fairly familiar with, or many health departments are. Can you talk a bit about how you incorporated NACCHO's MAPP framework, since it's most often used by health departments, but maybe not as much by the hospitals?
Sure, Jane, thanks. Just to give you a little bit of background about who we are first and then moving into that explanation. Here at Healthy Communities Institute, we've been working in this space for a little over 12 years now. We have experience working with hospital systems, broader systems, health departments, collaboratives such as the Kane Health Counts Collaborative, and really partnering with them to implement their community health assessments and then moving forward to developing implementation plans where they can address those health issues in their community. We've also implemented over 100 community platforms like the Kane Health Counts platform across the country. And these platforms feature national, state, and local data and can really be used as a hub for that community health planning. So moving on, I do want to speak to a little bit about how we typically approach community health assessments and how we really purposely worked with the Kane Health Counts Collaborative to ensure that we were also incorporating those key components of the MAPP process as well. So for us, for our assessments, really focusing on the community health assessment itself, moving on to being able to evaluate, plan, and actually implement those elements in the community that we've identified as being priorities. And I think there is opportunity to overlap with the MAPP process. And we're going to talk a little bit about how that aligns in the next slide. So here we can see, this is just an example of how we were purposeful in building in the components for this collaborative process, both to meet the needs of the community health assessment of the health department and the community health needs assessments of the hospital partners. So within the MAPP process, we have the forces of change assessment, the local public health system assessment that is key for that MAPP process, but isn't really required by the community health needs assessment. But it does provide additional information that can be layered in among the other pieces that we're already implementing, our secondary data analysis to understand, again, trends from that national, state, and local indicators, complementing that with community input from community surveys, as well as qualitative data analysis, understanding what the community is experiencing at that time through focus groups. So really, you can be purposeful, once you get over that hurdle of the 3-year versus the 5-year cycle. And in Kane Health Counts case, they were on that 3-year cycle purposefully to join in with their hospitals to all the benefits that Stacy mentioned previously. So there is potential in being able to align these key elements from the two processes.
Yeah, I think we really appreciate the purposeful approach in aligning these different aspects, both in terms of, I think, aligning the timelines as well as some of the interests of the group. So thank you both for that, for kind of giving that background. This next question is for Stacy. But I'd like to ask participants, so in chat, if you could include your response as well. So how did the events of 2020 change your expectations or needs related to your community health assessment? Were there emerging indicators or processes you were interested in reviewing as part of the assessment?
Yeah, that's a great question, Jane. Thanks. We were really interested to know how COVID-19 was affecting our community. We knew that there was a lot going on. The unemployment rate was up. There was civil unrest during the Black Lives Matter movement. We had some of our protests turn violent here in Aurora, where there was looting and destruction of property at some of our local storefronts. So it was a very stressful time for our community. This was, again, about a year ago, when we were starting to do our assessments. So we also knew that the pandemic was highlighting inequities that we had in our community. So our Latino population was being infected with COVID at a much higher rate than the rest of the population. At times, we were seeing a 7 times larger infection rate. So many of the outbreaks were occurring at manufacturing plants and meat packing plants, where there's a high population of migrant workers. Employees in those settings were often working for temp agencies and didn't have benefits of sick or paid time off. So on top of that, you're asking folks to stay home when they or their family members are sick, and then they may not get paid. So that's a huge stressor for our families. And in the past, in past assessments, the African American and Spanish speaking populations in our community were underrepresented in the data. So we wanted to make sure that this population was not being overlooked. We made a direct effort to collect feedback in focus groups from these groups, and we wanted to make sure that they had an opportunity to discuss their health needs, and they had a voice and a way to provide feedback to us. So in addition to our Black and our Spanish speaking populations, we are also concerned about getting feedback from our older populations. And not only were they at increased risk for COVID, and it was leading to a lot of fear and isolation and loneliness, we weren't sure how we would collect information from them online if they had access to like the technology. So we just wanted to make sure no one was falling through the cracks. So we worked with a few of our partners that had standing relationships and connections in the community with these groups. And Ashley's team did a great job of arranging virtual meetings so participants could call in and really provide that valuable discussion in a safe format. We even had our partners facilitate a Zoom meeting together with the older population, so they didn't have to actually call in and do the Zoom technology themselves, but could still participate and provide feedback. So that was really great. You can see that our this slide shows our past assessments such as this were done in a group format. We squashed tables together and we got flip charts and we shared markers, all kinds of cringy things that we don't do now since COVID. We knew that that wasn't going to be possible and we'd have to accommodate participants in a virtual format. So our Conduent team did a great job leading these meetings virtually, and we were able to collect some really great data.
Great, thank you so much, Stacy. And a question came in through chat that's related to this, so I hope you don't mind if I ask you this now, which was, how did climate change, environmental justice, and you've talked a bit about equity, play into your resilience planning?
Yeah, and these are things that as we work on our implementation plans, we have prioritized 4 areas which we'll get into, and these things will be considered you know, some of these themes did come up in like, say, a forces of change assessment. So some were discussed in that group setting, but we do expect that more themes such as those you mentioned will be discussed when we do our implementation planning moving forward for our community health improvement plan.
Absolutely. And I'm looking at some of the other comments in chat with our question of how this impacted the events of 2020 impacted everyone's community health assessments. And it looks like quite a few timelines were adjusted. I'm sure we can all identify with that. But that we're kind of seeing the silver lining is that we're really leaning on each other and the partnerships that we have. Knowing that we can't do it all. So I think a lot of health departments were able to lean on their community partners during 2020 when they were overwhelmed with the emergency response that they were working with, the COVID response that they were having to do. Just a lot of good themes coming out of this. I'm going to turn now to Ashley. Can you share how your team accommodated these needs that Stacy's team had from the health department? What were considerations that you had for conducting the CHA in the middle of the pandemic?
Thanks, Jane. I think at the core of what we're considering is, as we always do, looking at those data that's already available, trying to understand, how are things different than they were historically, looking at the national, regional, state level, looking at existing benchmarks. At the time, it was still Healthy People 2020. Now we're moving into looking at Healthy People 2030. Are things getting better? Are they getting worse? Really being purposeful in the types of data that we're integrating into the process. So again, in this case, for the CHNA and the CHA, doing that secondary data analysis, incorporating community input through community surveys and specific focus groups, and then layering in additional information from the forces of change assessment and the local public health system assessment. And we were very purposeful in how we approached that, again, and we're going to talk a little bit about it later, with how we modified the data collection tools, ensuring that COVID was, present in that. We were very purposeful in our focus groups, for example, asking about COVID at the forefront of that conversation, because, folks really wanted to talk about it and talk about their experience. And so we wanted to kind of get that out of the way at the top of the conversation and pivot back to discuss, other existing challenges that were going on in the community and perhaps how COVID was exacerbating that. I think moving on, we've historically, I think, in public health been considering social determinants of health and those upstream factors, for a long time now. But I think with COVID-19 and really seeing how COVID-19 was exacerbating a lot of the health issues that we were seeing in our community and coming up in these health assessments, it really pushed this conversation to the national spotlight too. So I think more people are becoming comfortable and understanding the necessity to look at our data in a specific way with that health equity lens, understanding disparities that has systemically existed in our community for a long time now. So I think it's important for us to look at the data in a particular way for us to be able to do that. Here at HCI, we leverage specific tools that we've developed, such as our Socio needs indicator, our COVID risk tracker, and our index of disparity. Our index of disparity analysis, for example, allows us to look at those national indicators by race and ethnicity, by age, by sex, so we can begin to understand in a more nuanced way who is experiencing those health disparities. And in the next slide, it just shows you an example of our Socio needs index. And this kind of allows us to understand the where within our communities, down to a zip code level, are we seeing opportunities for bigger impact. This index incorporates an estimate for 6 different socio and economic determinants of health, for example, income, economy, and education, that can be associated with poor health outcomes. And so, in this analysis that we did for Kane Health Counts in Kane County, again, not only understanding the health needs that were in the community, particular groups within the community that may be experiencing health disparities or disparate outcomes, but also understanding geographically where there is the opportunity for the most impact. And all those are important considerations as you move from an assessment process into your planning and implementation.
Absolutely. Thank you so much, Ashley. And I wanted to, a question came in, I think, about the process with which I thought maybe you could elaborate on, which was how was the participation in the virtual format with, say, older adult populations or migrant or immigrant populations? I know you mentioned several focus groups that you had conducted. Was it, were those groups included in the focus groups?
I think we, and I'm going to talk specifically about how we kind of pivoted and changed some of those, modifications within focus groups a little bit later, but they were actually a lot of fun. We did have to offer more opportunities to be able to host the focus groups than we typically would, I think, in a normal situation. But the partners from Kane Health Counts were really great. We had a nurse from Kane Health Counts that was also very active in a large African American church in the Aurora area. So we had a wonderful participation from their congregation, really robust conversations around, what was going on with civil unrest in the community, what was going on related to COVID. They talked a lot about men's health issues in particular. I have to laugh when I think about the older adults focus group. We were trying to get 10 to 15 individuals on those, and we ended up partnering with two older adult services at different parts of Kane County, and we ended up having almost 30 older folks from Kane County join, and they had been joining via Zoom for other activities because of COVID, but they were some of our most rowdy bunch. I think they were just wanting to share their stories, share their experiences, looking for that interaction, I think. And it was, I think, inspiring to see that, it wasn't really a barrier if they have support to be able to join those conversations. And they had a lot to say, a lot of opinions. So it was a really good focus group.
Okay, thank you so much. I'm going to now move us on. This next slide shows the priorities that were identified at the end of the CHA process using all the methods Ashley just talked about. So the focus groups, the community survey, the forces of change assessment, and the local public health system assessment, along with, of course, reviewing the community indicators. So as you see, the priorities were behavioral health, so that's mental health and substance use, access to health services, immunization and infectious diseases, and altogether exercise, weight, nutrition. We'd actually love to hear from participants in chat whether these are similar to the priorities you had identified in your communities or you've come up with something different. So if you've recently conducted an assessment, please post those priorities that you've identified for your communities. Back to Ashley, what were some insights? So having gone through this joint assessment process, what were some of the insights that you had? I think we'd especially like to hear about your take on how the group utilized or expressed those levers of resilience during the assessment process.
I think I'll start really quickly, just kind of pivoting back to the slide that you just showed, Jane. I think for Kane Health Counts and for many of our partners that we work with across the country, the health priorities didn't necessarily change from cycle to cycle when we were looking at the broader category. But I think the nuances within that and having a deeper clarity, again, around some of those social determinants of health points, and in particular, how COVID was exacerbating those health experiences or barriers in the community, was more clear after this assessment. But I think in general, as some of you guys have mentioned in your comments, even during these uncertain times, a lot of us are still responsible for meeting our IRS reporting guidelines, meeting those FAB accreditation requirements. And your focus is elsewhere, working on your community needs because of everything that's going on. So it's good to have partners that you can rely on to help, move this process along. And really, it's important for us to understand, as we've mentioned before, the exacerbation of health needs that are highlighted in these assessment processes and how they've been pushed to the forefront on the national stage because of the events that went on during 2020. I mentioned before, we were very purposeful in building opportunities to spotlight the COVID experience within the community during our data collection process. So COVID was obviously a topic of conversation for the Forces of Change assessment and the local public health system assessment. And as I mentioned before, we were very purposeful in the questions that we built into our community survey, asking the community how COVID had changed their experience, changed their access, changed their family dynamics, parents working from home, children being at home doing virtual learning, and all of the crazy things that we've all experienced during COVID. And we really came away with a clear understanding for some things that I am sure you guys have heard too, if you've been doing assessments and listening to your community during this time, that there's a clear need for better communication, consistent communication and information sharing around topics like COVID-19. But there was a positive in how our systems adjusted and we're trying to ensure that the delivery of programs really met members of the community where they are. I think we've all seen an expansion and reliance on telehealth and seeing how important that opportunity can be in the community for providing access to services that may not have been as strong prior to COVID. And again, I think we keep getting back to these multi-sector collaborations and how really having strong partnerships, can help you move forward in times of stress when you have to get these things accomplished and you're still wanting to make a commitment to doing purposeful work in the community. And the last slide here, I just wanted to highlight again how we were very purposeful and how we looked at the data. So we had our data that we historically looked at, but we wanted to layer in COVID, both in our secondary data analysis, but again, from our community input as well. I think the challenge with secondary data is that there's always that lag when you're looking at other data sources for when that information is available. So it's important in these assessments that we are able to complement that with real-time data from the community experience through surveys, through qualitative data collection, whether that be focus groups, key informants, what have you. And I think through that, we're able to get a more real-time insight into the community experience and a deeper insight and context for the social determinants of health and the impact of COVID.
Yeah, absolutely. Thank you so much, Ashley. And I was looking in chat, and it looks like the priorities that came out of the assessment are similar to many of your experiences. I noted some additional priorities that weren't listed, but really are related, really focused on social determinants of health around housing, transportation, environmental justice, violence prevention. So I think those were themes that probably came up during the assessment process. So it's interesting that we're kind of moving in that direction that public health has been moving in for quite a while now. I think just COVID and what's happened in the last year and a half or so has really put a spotlight on where we need to focus. So thank you for that. And Stacy, Ashley just shared some of her experiences and insights from facilitating this process. I'd like to ask you about, your experience from the health department's perspective. So we've put back up the slide with your the priorities that came up for Kane County. Were you surprised by the findings from these assessments? Someone in chat asked, were these very different from your previous assessment? So I think we'd love to hear from you from that health department perspective.
Sure. Yeah. Thanks, Jane. We really were not surprised at these findings. Some of the, specifically behavioral health, that had been a very high priority in previous cycles. And we knew we still had a lot of work to do. And the compounding effects of COVID really probably exacerbated a lot of the issues that, our community was already facing. So we knew we hadn't solved that problem. Access to health services had come up in the past, but wasn't ranked as high as a priority. But certainly with COVID-19 and, the effects of that and people being able to receive healthcare and having the vaccinations still down the road, we were not surprised that ranked high. Immunizations and infectious disease, again, was new, but in the environment of COVID-19, we really weren't surprised about that. We did have in our previous cycle, chronic disease was a priority, and we really felt exercise, nutrition, and weight complemented that well, and we could carry out a lot of our goals and our actions that we had done in a previous cycle and move that to combat exercise, nutrition, and weight. So while some of these needs had not been priorities in our previous assessments, we really weren't surprised to see these coming to the top.
Thanks so much, Stacy. And thank you so much for, all of these insights. Let's talk a bit about community and partner engagement, which is one of the levers of community resilience and one of the most important parts of community health assessments. Ashley, this question is for you, but we'd like to encourage, again, participants to answer this question as well. What types of tools or processes have helped you ensure engagement with your community and your partners throughout this process? So I think a lot of us had made some pivots, but we'd like, if you can answer in chat, that'd be great for our participants. But Ashley, as a facilitator, what types of tools did you use?
I think generally the way we like to approach our process working with the collaborative is just, again, being very purposeful at the beginning to understand the goals and objectives of the assessment, what key deliverables we're going to have, so that as we move forward, the needs of the different members of a collaborative are being met. We don't want to get to the end of our process and someone is, raising their hand and saying, hey, we didn't really get this accomplished for what I needed for X, Y, or Z. So I think that's really clear up front when we're working as a collaborative, that everyone's able to come to the table, share their needs and expectations. So, that as we're orchestrating our timeline and working through the different types of components that we're building into our assessment, that we're really checking off all those boxes for those folks. And moving on from there, I think, you have a broader working group, but I think it's good to identify a smaller working group that you're going to meet with on a more consistent basis. In the example of Kane Health Counts, we had a core team with at least one representative of the core members of the collaborative, so the different hospitals, the Inc. board, the health department, and they were the ones we were meeting with on a weekly basis to make the key decisions around tool development, implementation as we moved into marketing and pushing the community survey out. It was really important for us to have those frequent touch points. And then there were opportunities throughout the process to engage with the broader group. For example, the virtual prioritization session that we had with the community. We had, over 80 different community partners able to log on and be a part of that process, which, was very successful, even though we had to pivot to virtual. And I know a lot of you guys mentioned having to pivot to virtual last year because of COVID. And that was one of the key things that we had to do. So I think some of the key considerations, and I imagine you guys have seen some of the same, one of the key considerations once you've made the decision that, we have to move to virtual for one reason or the other, or even a mixed opportunity to do in person or virtual, is what online tool you're going to use. We're using Zoom in this instance. Depending on your agency, you may have MS Teams or WebEx or some other platform. So I think it's important to understand which platform you're going to use, and it may be different depending on which group that you're working with. So we leveraged WebEx and MS Teams, for example, working with the collaborative and for the public health system assessment and the forces of change assessment. But when we were hosting our focus groups, it was more conducive for us to use Zoom because community members had already engaged in that platform, whether it was through work or their community, volunteering, for example, or through their child's school. So we shifted and used that. We shortened our time frame for engagement when we do in-person focus groups, for example. Those conversations are typically, obviously, in person with a community partner, lasting, upwards to 90 minutes. And we pulled that back to 45 minutes because having an engaged conversation with community members that are coming together in a virtual setting that they may not be as accustomed to as those of us that are, working virtually day to day, it's really important to, keep that attention span in mind and keeping that accessible. And I think there's a lot more upfront housekeeping that you need to do to ensure, again, their comfort level, their ability to access and utilize that tool that you're going to be using for those virtual engagements. But again, I think there are positives. I'm sure that you guys have seen this too. You're able to have broader engagements when these are virtual conversations because, driving in from, remote parts of a county or a region are no longer an issue. So we don't have those travel restrictions. You may not, be having to, find a physical space that is conducive for those types of meetings or helping to arrange childcare or things like that. But I will say, even in a virtual format, it's still good to think about doing something to thank those participants, leveraging some type of thank you, like a gift card for the time that they're taking to come and engaging in those conversations. So thanks, Jane.
Thank you, Ashley. And Stacy, Ashley just talked about the engagement during that community health assessment process, but we know that really one of the most important things is for engagement is to make sure that that community health assessment, once it's published, doesn't just sit on a shelf somewhere. I think we've all been there where you've spent 8 to 12 months of your life, working on that community health assessment, and all you want is community partners and community members to use the rich information that you found and move forward together. So what has Kane County done to ensure that your CHA is a living document, that partners stay engaged in your priorities in the process moving forward?
Yeah, thanks, Jane. So one thing that we utilize is our Kane Health Counts website. And I think actually someone had asked in the chat how we decided to go with HCI to help us with our assessment process. We have actually partnered for quite some time. I think it was well over 5 years ago. This product was a new product, and we were really looking for a way to be able to provide our community with the data from these assessments. So we've had this, like I said, now for about 5 years, this website. So we utilize our Kane Health Counts website to publish our reports. You can, there's a custom dashboard. So we really encourage our partners, if they're doing any kind of presentations or are needing data, that this is your go-to. You can, pull all the latest data here. So we, as we work on our implementation plans, we do have established action teams. We also utilize this website to provide updates. We're actually in that planning cycle right now, so hope to be putting up our new plans here shortly after the summer, and we get some of those in place. But it's just a really great way to let our community know what we're doing, have our residents and our partners, allow them access to the data, and just have a kind of a one-stop place to find all of that.
Yeah, great. I know we used a similar thing in Orange County, and it was really important for us to have or a really critical tool for us to have with our partners to be able to look at the same data and also update our plans. So I really appreciate what you're saying there as well. So thank you both so much for your time and the rich discussion today. Before we close and go to questions and answers, I'd like to get back to this topic of community resilience. We've seen how a collaborative community health planning process, such as we've seen in Kane County, can really bolster community engagement, work towards health promotion, and build a strong public health response system. Can you, before we close, share any final words of advice for those who are looking to build the same type of collaborative approach? And I'll go ahead and start with Ashley.
Thanks, Jane. I think many of us have experienced this from trial and error. Maybe it's really important to start early and considering partnering in a formal or informal way. It doesn't have to be something as formal as what Kane Help Counts has set up. And that's not a partnership that you can establish overnight. It's going to happen over time. Again, aligning those timelines, ensuring that everyone's needs are being met as far as deliverables for those assessments. But I think we've also seen that even if we have to shift virtually because of what's going on in the community, it's still possible to implement a successful and meaningful community health assessment. I also think it's very important for us to continue to center the community in this process, considering all the different data layers and exploring all of this in our analysis and in the work that we're doing with a health equity lens. And just remember that it's a marathon, not a sprint. We a lot of times, I think, especially early on in the process when we were having to do these health assessments, we're trying to throw everything in that we possibly can. It becomes really overwhelming. And then, we're not happy when we're not able to make as big strides forward as we would like. So I think it's important for us to remember that it's important for us in these assessment processes to establish short and long-term goals and objectives, things that we'll be able to accomplish in a 3-year cycle or a 5-year cycle, and then think longer term. What can we accomplish as an individual entity or as a collaborative in 6 to 10 years? And then what impact in the community can we expect on an even longer time frame? But at the end of the day, it's really important for us to have these short and long-term community goals so we can positively impact health.
Yeah, absolutely. I think a lot of us can identify with that, wanting to throw everything in there because you think it's your last chance to do so. But I think this graphic really captures it, that, taking it kind of one step at a time and thinking about what you can do in the short term in order to get to the long term is really helpful. Stacy, by the way, I forgot to congratulate you on achieving reaccreditation during all of this. I think we'd really love to hear from you about, any words of advice for doing this work and having this collaborative approach while being at such a high quality or well-respected health department.
Well, thanks, Jane. I appreciate that. Just like Ashley mentioned, this wasn't something that happened just with even the last couple years. This goes back, 10 plus years with relationships. But I think when you're going through some more difficult times in public health, like with the COVID-19 pandemic, it really helped that we had those established relationships. So for us, we stayed connected through action teams. They were still meeting through Zoom on a pretty regular basis. And we did have months that went by when we were really just inundated with COVID response. But because we had those established partnerships and those relationships, a lot of times we were reaching out to those same partners for other things, PPE needs and, the need for staff and nurses to help at a vaccination clinic or something completely unrelated to our CHA-CHIP process. But, we were still connected. We still had those relationships. So I think that was really key. And it really, in some ways, brought us closer together because in the end, we were working on, a common goal of keeping our community healthy.
Yeah, thank you so much, Stacy, for that. And having sat in on some of those conversations, I think it's really clear that the relationships that you've built and those partnerships are really strong. Getting back to the community resilience, what we were talking about, the partnerships and the trust especially was really clear between your community partners and the health department. So really congratulations to you on that. And thank you for those words of advice. I think at this time, we'd like to open things up to the audience for any questions or comments. I saw some earlier in chat. I'm not sure if we're going to get to all of them. but one that I noted, this one I think is probably best for you, Stacy. How do you keep the work groups working together? Is that something that you use the website for?
So that we have recently started using, there is a calendar option on our website. So with COVID, it did get lost a little bit. We weren't meeting in person. So that is something though we have plans to use in the future. But really, they were meeting monthly and again, kind of transitioned to Zoom, and we're still able to do that. So they are continuing those monthly meetings through Zoom, and that might continue for a while because again, our county is kind of long. People are liking the no commute time when you meet in meetings like that. So so luckily they've still been able to make some progress on their plans.
Thank you. And I think you just addressed another question that came up, which is, have you considered continuing your work in a virtual format? I don't know if you want to elaborate on that anymore, Stacy.
Yeah, I do think that Zoom meetings are here to stay. We did send out a survey to our executive committee and just asked what their opinions were. And everyone likes the Zoom format. They feel that they're still effective and we're still getting work done and actually saving some time. So we're looking at possibly going to an in-person meeting, maybe 1 to 2 times a year when that's safe to do, and continuing with monthly Zoom meetings.
Thank you. And another question came in. I think this one would be maybe for Ashley, especially since you've worked with quite a few clients. So you might have ideas about how this is happening across, or when you've done this across the country, which is around, you mentioned focus groups with older adult populations. Can you talk a little bit, and other populations, can you talk a bit about, how do you do the recruitment for those? How do you ensure that voices who may not make it on Zoom or come to meetings are heard?
Yeah, I was responding to some of those questions in chat too. I think we had to be a little bit more diligent this go around with establishing the virtual focus groups than we would have to in a normal setting. But again, I think, whether you're establishing those focus groups or working with a partner to do that, it's good to tap into those collaborative partners in the community that are already working actively with those populations. So you're not having to, reach out to them out in a communication channel that they're not comfortable with or familiar with. So as I mentioned, we were working to establish for Kane County, for example, we wanted to reach out to the Hispanic Latino community, offer focus groups in bilingual setting. We know we wanted to reach out to older adults and aging, and we knew we wanted to reach out specifically to the African American community. So there was a lot of brainstorming within the collaborative, for over a couple of weeks to identify which key partners in the community we could tap to be able to do specific outreach and enrollment. We had emails, we had marketing verbiages, we had opportunities that went out on social media, and we also had flyers that had QR codes that people could call in. And it was trial and error too. We were sending out formal invitations with a closed Zoom that you had to have a code to log into. And that seemed to be a barrier for folks to join. And so the next iteration, we just had an open Zoom call, had the QR code, had the links available in all of our marketing so that people were, more easily able to access those. We also wanted to make sure for those that felt comfortable sharing their screen or had the bandwidth to be able to share their screen to participate in the conversation, they were able to do so. But we also gave them the option to say, hey, you have this call-in opportunity too. So we don't want you not to participate because you don't have access to your computer. You can use your cell phone and call in, and your voice is, just as important whether we can see your face on the screen or not. So again, just really rolling with it, seeing what worked, and every group is going to be different, I think.
Yeah, thank you so much. And I'll kind of echo that. I know locally, making sure that you're reaching out with voices that they've already heard. I really liked what you said about that. You know, we know sometimes if we're all getting those spam calls and spam emails that we're really suspicious about. I think almost everyone is not picking up the phone. So making sure that you're reaching out through familiar channels, you know, to introduce you or just to do the outreach is really important. Thank you so much for attending the session. I think this conversation has been so rich, both on screen and in the chat. Thank you for posting your experiences. Our information is posted on the screen, and thank you for your time today. And we will see you at the conference.